With science and speed, not chaos and confusion. That's how President Biden says America needs to fight COVID this winter. He outlined his new pandemic strategy today, just as U.S. health experts confirmed more new cases of the Omicron variant. Here are the key parts of the president's plan. Reimbursing Americans for at-home rapid tests, new testing requirements for travelers coming from other countries, expanding access to booster shots for all adults, and the opening of more vaccination sites targeted toward families. President Biden insists his strategy does not include any lockdown or new vaccine mandates.
My plan I'm announcing today pulls no punches in the fight against COVID-19, and it's a plan that I think should unite us. Experts say the COVID-19 cases will continue to rise in the weeks ahead in this winter, so we need to be ready.
Just last hour, the New York governor, Kathy Hochul, called a news conference to announce researchers identified 5 COVID Omicron cases in the state. Many of the details are still unclear. The governor says the cases appear to be mild, but she says this was expected and should not cause any alarm. Earlier today, researchers identified single cases in Minnesota and Colorado. Health officials in Minnesota say a man tested positive for the new variant after traveling to New York City last month. They say he attended this anime convention at the Javits Center. Governor Hochul urged everybody who went to that particular conference to go get a COVID test right away. In Colorado, health officials say there was a woman who tested positive for the new variant after she traveled to several countries in southern Africa. We have coverage from all angles tonight. In a moment, Meg Terrell and what health experts are learning about Omicron now. But first, to our senior White House correspondent, Kayla Tausche. Kayla, break down the president's new plan for us.
Well, Shep, the White House's plan is aimed at limiting the Omicron cases coming into the U.S. and decreasing Delta wave hospitalizations. To do that, the administration is telling pharmacies to schedule family vaccine appointments, demanding private insurers pay Americans back for rapid tests starting next month, and deploying crews from the Pentagon and FEMA to assist in hotspots. On top of a travel ban for 8 southern African nations where Omicron is surging, the U.S. is requiring inbound international travelers test negative 1 day before departure instead of 3, and extending a mask requirement for transit until mid-March. The plans build on programs the White House already had in place, but also represent less stringent measures than European counterparts, like the UK and the Netherlands, where travelers from overseas are subject to quarantine and mandatory PCR testing. The EU has also proposed that vaccine passports expire after 9 months when immunity wanes. A senior administration official tells me one reason the White House stopped short of quarantines and arrival testing, it's too hard to implement, especially without all states on board. And today, Press Secretary Jen Psaki acknowledged legal challenges could await.
We've taken a number of steps that are not intended to be controversial or divisive, but still may be perceived that way. But our most important factor is what is going to be most effective, and that's what we really base our decisions on.
On that note, the administration's vaccine mandates have run into fresh legal obstacles just this week, and some GOP senators have threatened to shut down the government if they're not overturned.